Welcome to J-Ray Lasers. We had hoped to meet you all in person back in May and thus allow you to experience our J-Ray, a wave that makes a true difference. Our J-Ray is a veterinary high-dose therapy and surgery laser system with great versatility and provides amazing results. With our on-site training, you will have the confidence and expertise to use high-dose laser therapy to provide this advanced treatment modality to your patients. As an aside, with this short video, please pause so you can read and review the slides, then simply click play to continue. Thank you. Let's begin. Let's introduce the J-Ray team. I'm Dustin, and this is James and Laura. Laura and myself want to visit your practice so that you can experience the J-Ray and learn how well it works with photobiomodulation therapy and laser surgery. James works very hard to keep us busy. Once you get the J-Ray, Laura will come out and provide our special on-site training so that you have the expertise to provide amazing therapy and surgery. Our J-Ray is the most versatile high-dose veterinary laser system, and we're proud of this. In terms of therapy, it can emit up to 15 watts at 810 nanometers and 15 watts at 980 nanometers. It does this in a pulse mode to minimize heat, yet provide high dosages. It's considered high dose laser therapy because it does emit greater than 10 watts at a single wavelength. It also is a surgical laser. Being a diode laser, it provides tactile feel since you contact the fiber onto the tissue, making it a lot easier to learn how to use versus a CO2 laser. The great feature of diode laser surgery is that as you're cutting or ablating, it is cauterizing the blood vessels and the nerves so that there's significantly less blood loss and it's significantly less painful for the patient. As mentioned, it cauterizes blood vessels and it's great for ablation. Another great feature of the J-Ray is it can work at the low end, the low power end. It can be turned down to 100 milliwatts so that you can use it for needleless acupuncture and also to stimulate trigger points. And finally, it's an additional profit center for your practice. Now let's hear from one of our veterinary practices.
This is Rascal. He 9-year-old Schnauzer, and he came in today for his first laser treatment.
So Rebecca brought Rascal to us because he's having some ear problems, so just an acute otitis, and we have a laser therapy machine that we're able to treat his ears with just a small little beam of light that is going to increase the healing time, it's going to decrease the inflammation, make him more comfortable in his ears, and it's all great because Rebecca doesn't have to medicate at home.
Laser therapy has an anti-inflammatory effect. It causes vasodilation and activation of the lymphatic drainage system, reducing swelling caused by biomechanical stress, injuries, overuse, or systemic conditions. It is great to use on performance horses and pre-performance, post-performance, and also to treat injuries. Here's a compilation of laser work done at an equestrian training facility. This next video shows the J-ray laser system in surgery mode during a feline neuter. This is a great practice surgery to get familiar with the J-ray. The J-ray surgery handpiece with an initiated fiber tip is able to incise and ablate with practically no loss of blood by cauterizing the blood vessels and the nerves, thus less pain. The surgeon commented how easy diode laser surgery is with precise control and no bleeding. Since you contact the fiber to the tissue, the learning curve is very shallow. Plus, the surgery site heals better than when using a scalpel. When we come out for a J-ray laser demo, we bring a banana as a surgical patient to show you how effective the J-ray is at cutting and ablating. This
Combination therapy
video
and
will
surgery
show
laser. So
Dr. Nathan Metz
basically, just like any
performing
laser, you
feline
have to be able
neuter,
to have
which
good
is
foot control.
another great practice.
Very important with the J-ray.
Using the J-ray. Enjoy.
To initiate and then release, so the way the tip does not get overheated and melts the glass diode. So here we are. We're going to go ahead and make our first incision. Just like with a regular laser, you need to have good skin tension. So putting tension against the skin, and we're going to go ahead and make our incision. So a good smooth swipe, release. A good smooth swipe, release. So we've got our first incision there, no blood. Next one, a nice even swipe, cauterizing and cutting at the same time. And then we're, like I said, that pedal control, releasing the pedal so that we do not overheat the tip. So we've got both our testicles extracted here. So we're doing this quasi-sterile technique. So we'll put the probe down. Grab our hemostats. Still no bleeding. Nice. So now we can go ahead and cut and cauterize this cord. So same thing. Nice swipe. Releasing the pedal, systematically swiping and releasing the pedal. It's a learning curve, of course, just like with a CO2 laser. With time, you can learn to cut better than you do char. There we go. Cutting, release, cutting, release. Cut the sponge. There we go. Tissue's not been charred, not much edema in the skin, so that should heal nicely with no blood. So, there you have it.
When you purchase the J-ray, we include a great reference, Laser Therapy in Veterinary Medicine Photobiomodulation, put together by Dr. Ron Riegel and Dr. John Godbold. This is a great reference book. It includes treatment protocols for hundreds of ailments. It also has some of the science behind laser therapy, some of the finances and how to incorporate the laser into your practice, and it includes all the references that were used to compile this information. And we will provide this book in hard copy or Kindle version. It's your choice. When I talk hundreds of ailments, I'm not kidding. Here's a very short list of some of the conditions that can be treated with our J-ray. Take a look, pause if you wish, and then when you're done, hit play. The next 4 slides are testimonials from some of our client practices. Please pause and read them, and then click play when you're ready to continue. Here's a testimonial from Dr. Dale McLeod, a great friend, and you all would have met him if we had had the conference in May. He's a great vet, and he's a character. Here's a testimonial from Dr. Nathan Metz. He's the doctor you saw performing the feline neuter surgery using the J-Ray and has used it extensively for both therapy and surgery. And here are testimonials from Dr. Barbara Walton and Dr. Robin Anderson. Now, what do you get with the J-Ray, you may ask? Everything in this photo you get with the J-Ray. It is a complete laser solution. You get the J-Ray laser, you get the telescoping therapy handpiece, you get the warning sign, the user manual, 3 pairs of safety goggles. These are specific to the wavelengths of the J-Ray. We include the carrying case. We also include the J-Ray laser surgery starter kit, an ear, nose, throat therapy handpiece adapter, and a foot pedal with a locking cover to be used for surgery. Thank you for taking the time to learn a bit about the J-Ray. I hope this has piqued your interest. If it has, let's continue this discussion online,
Even Marley
preferably,
loves the J-Ray.
and then we can schedule an on-site visit
The
so that
ray
you can
that makes
experience
the
the
true
J-Ray.
difference. Good girl. Yes, you are. You're a good girl. Oh, does that feel good? Good girl. Good girl.